So again, welcome everyone to the webinar on School Mental Health, a Federal Perspective. This is Sharon Stephen from the Center for School Mental Health at the University of Maryland School of Medicine, and we're delighted to welcome everybody today. We are co-hosting this webinar with IDEA Partnership. Following a brief introduction by me and then by Renee Bradley from the Office of Special Education Programs, we look forward to first hearing from David Esquith, Director of the Office of Safe and Healthy Students, Office of Elementary and Secondary Education from the U.S. Department of Education. Then we will hear from Ingrid Donato, Branch Chief, Mental Health Promotion, Center for Mental Health Services of the Substance Abuse and Mental Health Services Administration, SAMHSA. Between presenters, we will have about 5 minutes of questions, and we ask that you post your questions in the chat box since all lines will be muted. I would like to first acknowledge the pioneering role that HRSA, the Health Resources and Services Administration, has played in school mental health in our nation. In 1995, the Maternal Child Health Bureau of HRSA made major investments in advancing school health and mental health, and they have remained committed to advancing this agenda over the past 2 decades. One of these investments was specifically related to school mental health. That is, HRSA invested in 2 technical assistance and training centers, one in Maryland and one in California. In 2005, this investment evolved beyond just technical assistance and training into policy and program analysis. And in 2010, HRSA reconfigured this funding to award 1 national center, our National Center for School Mental Health at the University of Maryland. We focus on advancing school mental health policy, research, practice, and training at local, state, and national levels, and I'm privileged to co-direct this center along with Dr. Nancy Lever. In 2004, our center began co-sponsoring with the IDEA Partnership a national community of practice on school behavioral health, comprised of diverse stakeholders across the nation and internationally who are committed to engaging in school mental health. We have 12 practice groups that go deeper into specific content areas of school mental health, and these are illustrated here. If you want to know more about the national community, you can find it at sharedwork.org. We are privileged to convene our community at the annual Advancing School Mental Health Conference. Our conference moves around the country, and we will be convening this year, September 18th to 20th in Pittsburgh. We invite you to join us and to submit your proposals online. The due date is fast approaching. In addition to our national center, HRSA has made a commitment to school-based health care, including an investment into the School-Based Health Alliance, formerly known as the National Assembly on School-Based Health Care, or NASBC. The School-Based Health Alliance is a membership organization offering advocacy, technical assistance, and training related to school health. We thank HRSA for its continued commitment to advancing school health and mental health. And next, I'd just like to introduce Renee Bradley from the Office of Special Education Programs. Renee?
Thanks, Sharon. Hello, all. I'm glad to be able to briefly share some information on the mental health investment supported by the U.S. Office of Special Education Programs. The topic of mental health has been part of IDEA discretionary programs since the late 60s to improve outcomes for children with disabilities and their families. Sharon already talked briefly about the National Community of Practice on School Behavioral Health. It's facilitated by CSMH and the IDEA Partnership, so I'll start with the IDEA Partnership. That is one of OSEP's investments focused on broad educational issues, including mental health, that creates engagement with many and varied stakeholder groups. As part of this effort, they developed and have sustained the Communities of Practice strategy. And this community of practice strategy is one of the largest and most active that we have supported, including 16 state affiliates, 21 national education-related organizations, and 8 federal technical assistance centers. This collaboration has modeled on a federal level the value of cross-stakeholder learning partnerships coming together to address some of the most important issues facing our children in schools. An action example from this collaboration, in conjunction with another one of OSEP's TA centers, was the new monograph recently released entitled Advancing Education Effectiveness Interconnecting School Mental Health and School-Wide Positive Behavior Supports. That's available through either the CSMH website or the partnership website. OSEP also funds the PBIS TA Center that addresses mental health issues in the preventative multi-tiered school-wide framework that focuses on improving school climates to prevent, identify, and more effectively address the social, emotional, and behavioral needs of all children to enhance their school achievement. David will talk later about the department's overall efforts in school climate, of which OSEP's been a strong partner. In addition to those two national TA centers, mental health needs are also included and addressed in OSEP's early childhood TA centers and some of our teacher training and doctoral training grants, which prepare teachers, related service personnel, school psychologists, and faculty members for higher education. We have learned through all of these investments and over time that for entrenched and immense challenges such as addressing mental health needs of our children, our future success is dependent on our ability to engage in new kinds of action-based collaboration across agencies and professions, not only between ed and mental health, but also including child welfare, juvenile justice, families, and the youth themselves. Contrary to popular belief, deep and effective collaboration does not occur naturally. The Center for School Mental Health and the IDA partnership staff should be commended for modeling the important roles of these system conveners and the impact of this true cross-agency collaboration. Thank you for letting us share about our investments, and Sharon, I'll turn it back to you.
Thank you, Renee. So now I'm pleased to introduce David Esquith, who is Director of the Office of Safe and Healthy Students out of the U.S. Department of Education. And David will speak for a little bit of time on the education-related components of Now is the Time, and we will reserve a few minutes after his presentation for questions. So if you do have questions, please post them into the chat box. Thank you, David.
Well, thank you, Sharon, and thanks to Renee and to Nancy, and looking forward to participating in this webinar along with our good colleague Ingrid Donato from SAMHSA. And what I'm going to do is go through the education-related components of Now is the Time. And Now is the Time was the President's plan to protect our children communities by reducing gun violence. And the development of Now is the Time was prompted by the tragedy in Newtown, Connecticut on December 14th. And that afternoon, the Secretary of Education, other cabinet officials met and talked about the need to come up with a plan that would protect our children and communities and be multidimensional. And so this work is still ongoing. As we get into my presentation, I'll share kind of the latest developments, and there is some good news in terms of our ability to support new programs to address these very difficult issues. But almost immediately after Now is the Time was published in January, the Department of Education began collaborating with Justice, Homeland Security, Health and Human Services, and the FBI to implement the education-related components of Now is the Time. And so, as I said, I'm going to focus on the education-related components. There are other elements of Now is the Time that are being administered by other agencies. And Now is the Time has essentially 4 education-related buckets. And I think one of the things to take away from just this fact of the 4 buckets is that reducing violence, preventing violence, addressing school safety is multidimensional. And addressing 1 or 2 or even 3 of the 4 buckets here will leave us somewhat short in terms of our ultimate goals. So I'm going to go into the 4 education-related buckets and then give you an update on where we are in terms of the work that's being done. And the first bucket was to ensure that every school and institution of higher education had a comprehensive emergency management plan. The second bucket was to create safe and positive school climates in our nation's schools. The third was to make sure that students and young adults get treatment for mental health issues. And the fourth bucket was a school safety bucket. So I'm going to go into each one of these and give you a little more detail about each bucket. The first bucket was about emergency planning. And so now is a time instructed a number of agencies to develop a model for how to develop and implement comprehensive emergency management or operations plans, to give best practices in developing those plans, best practices on training and drilling, and incentives to have those plans. And that was done. If you take a look at the second bullet on this slide, on June 18th, the Departments of Education, Justice, Health and Human Services, and Homeland Security released guidance and models on how to develop emergency operations plans. And this was an event, this rollout was done by the Vice President. It has we believe that these new guides really set a high bar for school districts and schools around the country to develop and implement emergency operations plans that are in alignment with other federal agencies that do emergency planning. As part of this bucket, there was $30 million proposed for the Department of Education to make one-time grants to state educational agencies to help improve and increase their capacity to provide training and technical assistance to local educational agencies and to provide training and technical assistance. And as we'll see in a little bit, the good news is that funding for that initiative has become available in 2014. And finally, now is a time indicated that suggested to Congress that they require states and LEAs receiving school safety funding to have comprehensive, up-to-date emergency plans. The second bucket involves school climate. And the goal here was to help 8,000 schools create safer and more nurturing school climates by sharing best practices on school discipline. And some of you may be aware that the Department of Education, in conjunction with the Department of Justice, just did a big release of guidance on school discipline in order to end kind of this rash of suspensions and expulsions of students from minority backgrounds, and to give school districts some assistance and guidance on creating a more positive school climate and keeping kids in school. The second bucket also wanted to address schools that existed within communities with pervasive violence and promote the collection of reliable school climate data. So one of the legislative proposals was to for $50 million for the Department of Education to undertake a new initiative. And that new initiative has since been named kind of the School Climate Transformation Grants. And as I'll go into in a little bit, there is money for that is being provided in 2014 for these grants. They will assist schools to use the evidence-based strategies to prevent and positively intervene, to address problem behaviors such as bullying, drug abuse, and poor attendance, using by assisting local educational agencies to have more schools in their school district use kind of multi-tiered behavioral frameworks, or if they already have multi-tiered behavioral frameworks in place in those schools, to improve the fidelity of those that utilization. And another portion of bucket number 2 is for the Department of Education to collect and disseminate best practices on school discipline, which I already described. A third initiative that was included in this bucket was something that we call Project Prevent, which will help schools address pervasive violence in those cities where pervasive violence is a significant barrier because of the trauma or anxiety that that it places on students and staff in those communities. And finally, it directed the Department of Education to develop a model school climate survey, which we are doing and which will be available in the fiscal year 15 for testing, and then will be available to all schools free of charge. And we anticipate that this will be a very user-friendly school climate survey that will feed into the implementation of our school climate transformation grants. The third bucket had to do with mental health issues, and I know that Ingrid is going to talk about this, and so I'm not going to spend too much time here. This was another critical component that the administration identified in terms of reducing violence. These are programs that will be administered by Health and Human Services, and the goal was to reach 750,000 young people to identify mental illness early and refer them for treatment. There were kind of two components here. One is, and I believe this is being identified as Project Aware. One has to do with mental health first aid, and I know that Ingrid's going to talk a little bit more about that. And the other is to kind of really address and support individuals ages 16 to 25 who are at high risk for mental illness. The plan called for training of more than 5,000 additional mental health professionals, launching a national conversation, and I know that Secretaries Duncan and Sebelius have been doing that, and ensuring coverage of health treatment by finalizing requirements for health insurance plans to cover mental health and making sure millions of Americans covered by Medicaid get quality mental health coverage. This is another slide that talks about the proposed $55 million for Project Aware. I'm going to kind of move through this because I know Ingrid's going to talk about it. And additional funds that were proposed for HHS to offer students with mental health services, the services that they needed. I talked about the mental health professionals, the 5,000 additional mental health professionals, and the administration proposed $50 million to do that. And I know that Secretary Duncan and Sebelius continue to participate in events on a national conversation about increasing understanding of mental health. The fourth bucket had to do with school safety. And now is the time proposed that 1,000 more school resource officers and counselors be put in schools. There are proposals, and there will be funding available to help schools invest in school safety equipment, training crisis intervention teams, and other school safety activities, and allowing school districts to choose what type of support they needed most. So I think this is one of the really insightful parts of this part of the plan, that the administration recognized that there are different communities, different schools have very different needs, and whereas the priority for one school might be a school resource officer, for another school it could be a school counselor or a psychiatrist or a psychologist and social worker, so that there was an objective here of trying to provide schools and school districts with as much flexibility in terms of identifying their needs and then applying for grants to address those needs. The COPS program of the Department of Justice was given in fiscal year 2013 under their program, put a priority in place to enable more school systems to access school resource officers. There was $150 million proposed for a new comprehensive school safety program. And as I'll get to in a moment, I'll give you kind of a rundown of the actual appropriation of that program. So here's kind of a summary of the funding that was included in Now is the Time. The three education programs, the emergency management for $30 million, $50 million for the school climate transformation grants, and $25 million for Project Prevent. This slide gives you the proposed funding for Health and Human Services for Project Aware, and the training of additional mental health professionals, and then finally the proposed $150 million for the Department of Justice. Let me kind of go back before I give you those slides for further information. What we have, the good news in 2014 is that Congress has made funding available to the Department of Education. It has made funding available to Health and Human Services and the Department of Justice, so that, speaking for the Department of Education, in our forecast, we have identified the fact that we will have new grants this year. Two types of school climate transformation grants. One set of grants will be to state educational agencies to provide them with support for increasing their capacity to support local school districts who are interested in expanding and improving their use of multi-tiered behavioral frameworks within their schools. And there will be another set of grants that will go to local school districts or consortia of school districts in rural areas to expand and improve the utilization of multi-tiered behavioral frameworks in those schools. So those are the school climate transformation grants. We will make grants this year. We will also be making one-time grants to state educational agencies to improve their capacity to provide technical assistance on emergency management. And finally, we will be making new grants this year under Project Prevent, which are to help those school districts in communities with pervasive violence to not only prevent the violence, but also to deal with kind of the toxic effects of those violence and the students who may need mental health services in order to address the challenges that violence presents to them. So those are kind of three new programs for the Department of Education. We do know that the Department of Justice did receive $75 million and not $150 million for the Comprehensive School Safety Program. And we're looking forward to working with them to make sure that those funds give school districts as much flexibility as possible, and that the mental health, school safety, school climate needs of those schools and school systems are met. So that is a quick run through of what was proposed in Now is the Time, as well as what we know is kind of on the drawing board. Let me give you a slide that gives you a little more information about each in terms of if you're looking for further information. One is the White House website for Now is the Time. Some of you may know that the Department of Education runs a emergency management technical assistance center, as well as a technical assistance center that deals with school climate and safe and supportive learning environments. And there you also have my email address and telephone number. So at this point, what I want to do is open up to any questions any of you may have, and I have I can see kind of in the chat room some of the questions, so let me try to go through those. And the first question is the $50 million for school transformation grants and $25 million for Project Prevent going to be taken out of the $90 million allotted to SDFS national programs in 14. That is correct. That the Congress, all of these programs will be run out of Title IV, which are national activities for us, and the money for all three programs will be coming out of the $90 million that Congress has designated for Title IV. And then the follow-up question is, to which department or office are the mental health personnel training programs going through? And that's something that Ingrid can talk about. That'll be coming out of HHS, the 1,000 school mental health and SROs funding through NIJ. That's a question for the Department of Justice. I believe that those funds are coming out of NIJ, although I think they'll be working closely with the and that's the National Institute on Justice. We'll be working closely with the COPS office. And then there was another question about the amount of funding that we received this year. I think I answered that. Where can I get a copy of the grant applications for the school climate transformation grants? Keep your eye on the Federal Register as well as our newsletter. They're in clearance right now, so you know, if things go well, we assume that they'll be out in the spring, and we'll try to give people as much time as possible to apply for those. We're looking forward to a lot of high-quality applications and really kind of scaling up the pioneering work that our colleagues in the Office of Special Education Programs and Renee have done in really scaling up kind of this multi-tiered behavioral framework, which is commonly known as PBIS around the country. Next question is, how much funding will be available for the two types of school climate transformation grants? That information is still kind of in deliberation. I can't be more specific at this point because it isn't public, but we're hopeful that there will be enough funding for both the SEA and the LEA school climate transformation grants to, as I said, really scale up these programs in a significant way. Next question is, have the proposed application guidelines or guidance placed in the Federal Register? Not yet, but as I said, it's going through clearance, and when we do put these notices inviting applications into clearance, you can be sure that we're going to use every avenue we can to get the word out about them, to have pre-application meetings. We want to really promote kind of high-quality applications, be as helpful as we can to getting those applications in, and make every effort to get the word out that those are available. Next question is, do you foresee school districts being able to receive funding through the school climate transformation grants if they've already begun implementing PBIS? The answer is yes. These grants will be used to expand and improve the utilization of the multi-tiered behavioral framework in schools and school districts that either don't have them in place or have them in place but can use the funds to improve the quality of and fidelity of the implementation to the framework itself. So again, we're trying to promote the flexibility here and increase the number of schools that are using the framework. And if a school is using the framework and the quality of it can be improved, then we will allow funds to be used for that purpose. Next question, how will mental health be part of the school climate transformation grants? That's a great question. The answer is that, as all of you know, with the multi-tiered behavioral framework, the concept, the logic model is implementing evidence-based programs within that framework. And if there are evidence-based programs that address kind of the mental health needs of students in the school, then certainly the transformation grants will promote kind of improve mental health services through the establishment and improvement of the framework itself. Will private schools be eligible to receive grants? Very good question. Under Title IV, we do have provisions that enable non-public schools to participate for equitable participation in all of our programs. So those equitable participation rules will apply to the Project Prevent grants as well as the school climate transformation grants. I'm going to check my time here. I think I've still got a few minutes.
Yeah.
If a community has received a Safe Schools Healthy Student grant in the past, would that prohibit them from receiving any of these new grants? Absolutely not. The eligible applicants will be local educational agencies, and the funding is not. There's nothing that would prohibit a school district that received a Safe Schools Healthy Student grant from receiving a school climate transformation grant. As a mental health agency, how can we present to the school districts as a partnering effort for these grants? You know, that's a great question, and I would perhaps turn to my colleagues who may have better ideas than I in terms of how mental health agencies can have been successful in the past in working with school districts. I would assume that school districts who have an interest in these school climate transformation grants will be interested in partnering with those agencies who can present an evidence-based of effectiveness, and that will certainly be something that we'll look for in the applications themselves. The commitment to the framework, as well as the indications of utilization of evidence-based programming. Can for-profit mental health consulting firms do the direct training and consultation through these grants? Not certain what that question is about, quite frankly. Stu, if you can elaborate on that, I'll try to come back to it. Can a nonprofit organization that partners with the State Department of Education be a recipient of the grant? I assume this is a question that I assume is for the SEA school climate transformation grants, and you know that there are no restrictions on partnerships as long as the state educational agency for these grants would be the primary applicant. And I see that there was a question before that the safe and supportive website link is inactive, and our friend and colleague John Terry points out that the website address apparently was changed from what I had up there, so I apologize for that. It is now all one word, safesupportivelearning.ed.gov. Next question, are Title I DOE personnel involved in any of the conversations regarding school climate transformation grants so that a direct connection to school improvement is made? That's a great question. We do talk regularly and share information with our colleagues here in the Office of Elementary and Secondary Education, so that the Title I personnel should be fluent in terms of how these the purpose and mechanics of these grants. Will schools have the ability to choose which mental health programs they want to implement, or will there be a list of programs that they must choose from? No, the notice inviting applications will be written at a very high level in terms of the application requirements and program requirements, so that local school districts will have a kind of total discretion on who they may want to collaborate with in terms of applying for these grants. I'm having a little trouble reading this one. In some counties, is the U.S. the county educational agency is the key administrator of services? Will U.S. Ed open eligibility up to organizations such as intermediate students? And the answer is yes. I indicated that we're going to allow kind of consortia of small school districts to apply for the LEA School Climate Transformation Grants. And again, we're going to try to be as flexible as possible to recognize kind of the different organizational structures that may be out there. Question, sometimes federal grants can only be utilized with nonprofit training consulting groups, and I was just clarifying that schools could use these funds with a for-profit consulting group. Yeah, we're going to encourage as much flexibility as possible, as long as kind of the applicant is considered one of our eligible entities under the Act. Does the school climate transformation grants link directly to mental health professional trainings to support students and young adults? Well, it certainly could. We want to kind of tap into the creativity of state and local educational agencies to develop the partnerships that they feel are most effective. We're going to write these notice inviting applications broadly and encourage, kind of creative partnerships as much as we can, and allow school districts to link directly to and collaborate with a wide range of professionals, including mental health professionals, if it means the implementation of the framework being done with fidelity. And I'm up. My good friend Marlene Wong is. I'm going to wait 1 second while the next question comes up.
It does appear that a few people are still typing questions, so we have a couple of more minutes for questions.
Our good friend and colleague Marlene Wong writes, may universities be partners with schools and school districts in these grants? And the answer is that there's no reason why they couldn't be. We're looking for expertise, for evidence-based programming, and to the extent to which there are university programs that can contribute to local school districts expanding and improving the utilization of the multi-tiered behavioral framework, they should be kind of welcome partners here. Will there be guidance provided to connect academic achievement with the social, emotional, behavioral competency developments to stress that applicants are required to integrate this program? That's a good question. And, again, I think what you'll see in the notice inviting applications is a great deal of flexibility, enabling local school districts to identify kind of their desired outcomes towards implementing the framework with fidelity. And we do know that when kind of multi-tiered behavioral frameworks such as PBS are done with fidelity, we do see not only improvements in academic performance in some cases, but also kind of the prevention of certain disruptive behaviors, and we would certainly hope that to the maximum extent possible, school districts take a broad and creative view towards the utilization of the framework. And how can we get alerts when the grants are posted or released? The Office of Safe and Healthy Students puts out a newsletter. As I said, we're going to heavily publicize that these grants are out. So I know that our colleagues at the center, at this center, at other centers, will be putting word out, and I would also encourage you to keep an eye on our Safe and Supportive Learning Technical Assistance Center website. So having said all that, I think I'm going to sign off, and I wanted to thank you all for allowing me to participate in this webinar today, and thank you to my colleagues.
Thank you so much, David. We really appreciate your time and all of the information you provided. And David has graciously given his contact information on the slide, so if there are some follow-up questions, I will direct you directly to David Esquith at his email address, and a phone number is also listed there. Thank you so much, David. And now I'll go ahead and move on to introduce our colleague Ingrid Donato, who is the Chief of the Mental Health Promotion Branch out of the Division of Prevention, Traumatic Stress, and Special Projects, Center for Mental Health Services at SAMHSA. Welcome, Ingrid, and thank you.
Hello, can you hear me?
We can.
Okay, wonderful. Good afternoon, and thanks so much for letting me take this time to talk with you. David just did a great job walking us through the federal components of Now is the Time. And just to recap, SAMHSA's involvement, which David outlined in slides, I believe, 16 through 19, is overseeing Project AWARE, which stands for Advancing Wellness and Resiliency in Education. We have received $55 million from Congress to issue grants to reach 750,000 young people through programs to identify mental illness early and refer them to treatment. $40 million will go to help school districts work with law enforcement, mental health agencies, and other local agencies to assure students with mental health issues or other behavioral health issues are referred to the services they need. This initiative will build on strategies that for over a decade have proven to decrease violence in schools and increase the number of students receiving mental health services. $15 million will go towards providing an awareness and early identification and referral training, such as mental health first aid, for teachers and other youth-serving adults. As David also mentioned, SAMHSA received funding to support a program for transitioned age youth to support individuals aged 16 to 25 at high risk for mental illness. $25 million will go towards innovative state-based strategies to support these young adults. We also receive funding for a program that will be jointly administered with HRSA for workforce development. Now, I know that quite a number of you dialed into this webinar, and as we're hearing from the questions that you've been posing to David, to learn all the details of these funding opportunities. But as much as I would love to give you all of the details, as David has mentioned, they're not public yet. So I'm really limited on what I can tell you beyond what David outlined in his presentation. But please feel free to type in those questions, and I'll do the best that I can to answer them. If you are interested in these funding opportunities, which sounds like you are, I encourage you to visit grants.gov and to sign up for their alerts. You can get daily alerts when these funding opportunities are posted. You can also go to samhsa.gov and look at their grants, and you will get up-to-date alerts about when these announcements will go out, and when the pre-application webinars, which is when we can really get into the details of these requests for applications or RFAs, will be posted. So let's start with the big picture. What I can do is give you a background into our thinking behind our program development and really look at the big picture of what we hope to accomplish through these funding opportunities and through our existing programs. So what is our call to action? What are we really hoping to accomplish? I don't want to put words in President Obama's mouth. I think he's done a wonderful job articulating what we're trying to accomplish this. But I believe when we are all reflecting on the tragedies that have occurred, the shootings in Newtown, which triggered the development of Now is the Time, and the subsequent tragedies that follows, we are really thinking about making a real change in the way we approach children's mental, emotional, and behavioral health. So what have we learned so far? What has worked? What's missing? How do we pull this all together? We at SAMHSA, the Substance Abuse and Mental Health Services Administration, start with our particular charge. SAMHSA is the agency within the U.S. Department of Health and Human Services that leads public efforts to advance the behavioral health of the nation. SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. I love that. No small charge, and one that is as important to you, I hope, as it is to us. We are guided by 8 strategic initiatives, with the first being creating communities where individuals, families, schools, faith-based organizations, and workplace take action to promote emotional health and reduce the likelihood of mental illness, substance abuse, including tobacco, and suicide. This initiative includes a focus on the nation's high-risk youth in tribal communities, and military families. And you will notice that schools are front and center in that charge. We also know that to achieve positive mental health outcomes for children and youth, we need to address the entire wellness spectrum. We need to promote positive health. We need to prevent problems from occurring when we can by looking at those risk and protective factors that we know impact emotional development. And we need to treat children early and effectively when problems arise, and we need to optimize health for all and sustain recovery. This is a slide that came from a book that was sponsored by SAMHSA called Public Health Approaches to Children's Mental Health. If you're not familiar with this, please drop me a line and I can send you a link to it. SAMHSA is a public health agency, and as such is guided by a public health approach. With a public health approach, we take a population focus. We look to create supportive environments where kids can develop into productive and successful citizens. We work to support optimizing these environments with ensuring effective treatment when problems arise, and we know that cross-system and cross-sector collaboration is key. No one agency, no one discipline can do this important work alone, and we know that one blanket approach is not going to work. Programs and initiatives need to be responsive and appropriate for the community they are impacting. Preventing the onset of mental disorders and promoting children's health and well-being need to go hand in hand with ensuring access to effective treatment. David Shern, Director of Mental Health America, put it beautifully. Do we invest in antibiotics to cure people who get sick, or do we invest in cleaning up the water that is making them sick? We need to think of both. We need to treat children effectively, and we need to create these environments where they can grow and be healthy. Now, this is a great chart that was developed by those terrific folks at the Institute of Medicine, National Academies of Science, and can be found in the 2009 report, which was also sponsored by SAMHSA, Preventing Mental, Emotional, and Behavioral Disorders in Youth, Progress and Possibilities. If you haven't read it yet, I encourage you to do so. You can drop me a line, and I can send you the link to the free download. In this chart, we see the interventions and activities that are appropriate at each developmental phase. Overlapped on it are a couple of our current grant programs that you may be familiar with. I'm going to touch on them briefly because, as I mentioned before, I can't tell you all the details of Project Aware and our Now is the Time initiatives until they are announced publicly, but I can tell you what we are currently supporting. So let's talk a little about each. Now, we start in the beginning of the developmental spectrum with pregnant moms and babies with Project Launch. This grant awards between $800,000 and $900,000 a year for 5 years, depending on the cohort, to states, territories, or tribes and a pilot community to foster healthy development and wellness of all young children birthed through age 8, preparing them to thrive in school and beyond. Their objectives are to improve coordination and collaboration across child-serving systems, to improve access to high-quality care and evidence-based programs for young children and their families, and to raise awareness and increase knowledge about young child wellness through public education and workforce development. They have 5 core strategies of developmental assessments in a range of child-serving settings. integration of behavioral health into primary care, really getting that mental health message out into the different child-serving systems, mental health consultation in early care and education, enhanced home visiting with a focus on social and emotional well-being, family strengthening, and parent skills development. We recently awarded grants to New Jersey, Tennessee, Oklahoma, Louisiana, and the Standing Rock Sioux Tribe, and we are currently seeking applications for our 6th cohort of this grant. If this is a funding opportunity that is of interest to you, please go to grants.gov to samhsa.gov, and you can download the RFA, and you can always drop me a line with some questions about that. So they're actively seeking applications right now, and that closes in March. The next slide is about prevention practices in schools. This is a grant program that offers funding to low-income, local education agencies to implement a classroom management evidence-based program in the 1st and 2nd grade. When implemented with fidelity, this universal prevention program has shown pretty impressive outcomes of reducing an array of poor outcomes such as illicit drug use, suicidal ideation, the development of antisocial personality disorder and conduct disorder in later years, and improving important outcomes such as graduation rates and even improving spelling scores. Now, this was a newer study. Spelling was the first thing they studied, and it's likely to impact a number of different educational outcomes as well. And the next grant program opportunity that I want to talk about, one that you are likely familiar with, is the Safe Schools Healthy Students Initiative. Since 1999, Health and Human Services via SAMHSA and Education and Justice have collaborated on this initiative that draws on best practices of education, justice, law enforcement, social and mental health services to encourage communities to use a community-focused, collaborative approach to creating safe schools environments and preventing violence, to delivering alcohol, tobacco, and drug prevention programs, providing and promoting student behavioral, social, and emotional supports, promoting school and community mental health services, and providing early childhood social and emotional learning programs. And here's a slide that shows the reach of the Safe Schools Initiative since 1999. And the initiative works. We know we are missing some of my details on the slide here. Shortly, we will be posting findings from the cross-site evaluation of this initiative. We have a series of reports that will be available from the SAMHSA store that have these studies available for you. If you haven't already, you can sign up for the alerts from SAMHSA, letting you know when these new resources are available. And we have recently taken what we have learned about the Safe Schools Healthy Students Initiative and brought it to the state level. These have been traditionally grants awarded to the local education authorities, agencies, and we have now been able to offer 7 grant programs, 7 cooperative agreements to Connecticut, Michigan, Wisconsin, Nevada, New Hampshire, Ohio, and Pennsylvania, who are currently working with 3 communities within their states to develop a comprehensive plan using the Safe Schools framework. These grants support that important cross-agency, cross-discipline work that is so critical. And the last program that I will touch on is Systems of Care. As we extend out of the prevention and promotion side of our work with youth and children, we move into systems of care, which supports the cross-system collaboration that supports improving access and expanding the array of coordinated, community-based, culturally and linguistically competent services and supports for children and youth with serious emotional disturbance and their families. These are family-driven and youth-guided with the strengths and needs of the child and family, determining the types and mix of services and supports that are provided. They are community-based to facilitate access to and utilization of appropriate services and supports, really ensuring that those kids who need help get it. They are also currently accepting applications. There are RFAs that are available now for the systems of care. There's their expansion implementation grants, expansion planning grants, as well as circles of care, which are tribally focused systems of care. You can find the details and the links for these applications on samhsa.gov and grants.gov. So here we have a nice picture showing how they kind of all flow together, not saying that Project Launch is tinier and Systems of Care is bigger, just a nice spectrum about how they're building on each other, building on a developmental spectrum, all working to support safe, healthy, and successful children, youth, and communities. So as we move to the future, let's strive to ensure that communities as well as the nation at large shape the world that our children live in positive and supportive ways. Promote children's overall well-being, and the physical health and mental health are inseparable. Provide the whole continuum of services that are necessary to support our kids, and help all kids manage the stresses that they will face, and help all children strive to be the best that they can. It is important to them, it's important to their families, and it is critical to our nation. And again, from our friends at the Institute of Medicine, there are 10 key messages for envisioning the future. We know that factors shown to improve the physical and mental health of children are addressed and enhanced by the systems that provide services to them. Families and children have ready access to the best available evidence-based preventive, early identification, and treatment interventions delivered in their own communities in a way that is meaningful to them. Preventive, early identification, and treatment interventions are provided as routine. These are components of school, health, and community service systems. A well-organized public health monitoring system is in play to track the incidence of mental, emotional, and behavioral disorders and are used to direct resources. Services are coordinated and integrated with multiple points of entry, that we are there to, we're out where the children and the families are. We need to get into all of those youth-serving arenas. As new preventative early identification and treatment interventions are developed, they are rapidly deployed. We're developing these statewide systems, these national dissemination systems, and we need to use them effectively. Families are informed that they have access to resources when they need them. We need to help families link families with these supports without those barriers of cultural cost or type of services. This is really something that the federal government can and should help with. Families and communities are partners in the development and implementation of preventive, early identification, and treatment interventions. The development and application of preventive, early identification, and treatment intervention strategies contribute to narrowing rather than worsening health disparities. And teachers, child care workers, health care providers, and others are routinely trained on approaches to support the behavioral and the emotional health of all young people and the prevention of mental, emotional, and behavioral disorders. So as President Obama stated after the shooting in Newtown, we won't be able to stop every violent act, but if there is even one thing we can do to prevent any of those events, we have a deep obligation, all of us, to try. We have a roadmap in which we are continually refining to help us do just that. So before I end, I wanted to quickly show you how we have been moving ahead on the President's Plan. As David mentioned in his presentation, we were able to launch, President Obama, along with Secretary Sebelius and Secretary Duncan, launched a national conference on mental health aimed to bring mental health out of the shadows. Bradley Cooper was on hand. You can see him sitting next to SAMHSA's Administrator Pam Hyde. Glenn Close was there to provide inspiring messages. We've kicked off community conversations across the nation to get Americans talking about mental health in the hopes of breaking down misperceptions and to find innovative solutions to mental health needs that are focused on the needs, the strengths, and the resources of their communities. Questions that they've been asking at these community conversations include, what does mental health mean to me in our community? What can we do to support the mental health needs of our communities? And what are the action steps we need to take? Tools and materials were developed and are available free of charge to help communities hold their own conversations. You can find them on the SAMHSA store. And you can track what is happening across the country on this map. You'll see those little pins there. You can click on them to find the details about the conversations that have been happening or are being planned in your area. 80 community dialogues were held in 2013 already, including in the lead cities of Washington, D.C., Kansas City, Sacramento, Albuquerque, Columbus, Franklin County, Ohio, and Birmingham, Alabama, with 52 communities in the planning stages currently. And to continue with our message of we can't do it alone, this is just a quick little snapshot of some of Sacramento's partners that they were able to pull in. And here is a shot of Sacramento's conversation. They had a goal to develop an action plan for the next 12 to 18 months to reframe mental health, to enlist a broader base than the traditional mental health service providers, and consequently, community leaders began normalizing mental health conversations in their community. And we're always thinking about new ways of getting the word out, and those conversations started. Text Talk Act is another element, a new innovation through the Creating Communities, these community conversations that facilitates small group conversations via text messages. So you get a group of 4 or 5 people together, text START to 89800, and you'll be walked through a series of questions aimed to stimulate conversation. You'll text back responses that are aggregated and included in a national conversation, which also helps us track the thinking across the nation. We've launched mentalhealth.gov. All of these that we have been talking about were elements of now is the time that we could implement immediately. These were activities that we started with really no money attached to them whatsoever. President Obama set out a charge, and these were ways that we were able to go and implement activities right away. Mentalhealth.gov is a website that aimed to provide information and resources on mental health topics and provide information on how to access care. There's treatment locators on there to help people navigate what resources are available locally and give them the guidance that they need to get immediate help. And so although I couldn't give you, I imagine, all the details that you needed, I do hope that you have a broader understanding of the types of funding that exist right now and know to keep an eye out for these new opportunities in the future. Much like David mentioned, I think he mentioned we're hoping to aim for spring launches of these new funding opportunities. And if you tracked on grants.gov, on samhsa.gov, they'll give you the up-to-date information on it. We all need to be working together. individuals, families, communities, cross systems and sectors, and across disciplines. Children's well-being and their mental health belongs to us all. We need your voice as we go forward with these timely and exciting opportunities. I hope to hear from you all. Together, we can make a huge difference for young people of our nation. So thank you very much for allowing me this opportunity to speak with you all. I think that we have some questions in the chat that I will try to help, and please feel free to drop a line. I know someone had asked a question. Let me scroll up.
Ingrid, I believe the first question after your segment started was Marcy's question, a few questions up.
Oh, okay, here we go. Hold on one second. Oh, what is it meant by implemented with fidelity, and will there be oversight to ensure districts are appropriately utilizing grant monies and implementing effective programs? Absolutely. Evidence-based programs come with their measures of fidelity. These are measures that are specific to the programs. These are tools that our project officers who are charged with overseeing the monitoring of grants work with grantees to help ensure. These are different for each evidence-based program. The evidence-based program that I was referencing earlier was the Good Behavior Game, which has fidelity checklists that grantees use to ensure proper dosage, to proper training, all of those sorts of things to make sure that an evidence-based program isn't just pulled off the shelf and put in any way or fashion. We have project officers that are linked with each of our grant opportunities to work with grant recipients to ensure that there is quality oversight with these funding opportunities. You will see that some of our funding opportunities are grants and some of them are cooperative agreements. The difference is when we feel that there needs to be a greater partnership between federal staff and with grantees, these cooperative agreements will be put in place so that there's shared ownership of the delivery of these services. Let's see. How does the good behavior game fit into a school's use of the Second Step program, which has been widely disseminated by the U.S. Department of Education? So the Good Behavior Game is an evidence-based practice that it's a classroom management technique and program that is used in the first and second grades primarily, although sometimes earlier and sometimes later, and it fits well in an array of other programs and frameworks. Specifically, we talk a lot about education's emphasis on putting a lot of funds and interest into supporting the advancement of a multi-tiered behavioral framework like PBIS, and the Good Behavior Game fits in quite nicely with that. So these are all evidence-based programs that we look to put in to link and to support other programs and other frameworks along the developmental spectrum. How was the program sustained after the grant ended? I'm not sure what grant program that references, but in general, with all of our grant program, sustainability is something that we work with grantees from the get-go to address. This is something that project officers, technical assistant specialists, and a variety of other people work with grant recipients from the get-go to develop plans and strategies to support these programs once they're in place. It differs depending on which grant program you're implementing, but usually involves building on those networks that are those community networks and those system networks that are developed through the grant to help sustain those programs once federal funding has ended. The Safe Schools program has been an excellent program. Thank you. We completely agree. And is effective. Thank you. We completely agree. Why is the support and funding for this program being scaled back? We like to think of it as scaling up. We are taking what we've learned from the local level and trying to move it to wider dissemination. I think we can all agree that not only are local budgets being cut and state budgets being cut, the federal government, federal budgets are being cut as well. So we need to really maximize and start expanding the lessons that we've learned, which is why we are trying to move from the local level to get that important state engagement to move these programs to wider dissemination. Will these slides and a recording be available after the live webinar? I believe that they will. Oh, that has already been answered. Can we see the link to download from SAMHSA from 2 slides? Oh, thank you. Okay. All right, mentalhealth.gov. The site doesn't actually include providers that offer recovery. Yes, mentalhealth.gov was launched. I feel like it was launched 5 minutes ago. So it is a new fledgling site that is being built as we move. So what we had done when we launched mentalhealth.gov was really pulled from resources that were available. We pulled from a variety of different federal sources that have already been vetted. We already realized that they came from legitimate sources and pulled them together. But this is a website that is meant to be dynamic and ever-changing. This is not a static website, and it will be changing and expanding as we move on. So please go back and visit it often, as it will be expanding. And peer support is something that you probably know is very important to SAMHSA. So I imagine that you'll be seeing a lot more resources built into mentalhealth.gov as we go on. Okay. I think I've gotten to the end of the question list.
That's wonderful, Ingrid. Thank you so much for your presentation. Very thorough. It looks like there may be one more question. Let's see what this is. Oh, that's just a comment. Great. So thanks again, Ingrid, and to David, and on behalf of our Center for School Mental Health and the IDEA partnership, we thank everybody for their participation and their interest in the topic of school mental health. And we look forward to a continued dialogue around all of these efforts as we move forward together. Thanks, everybody. And again, this webinar will be posted online, both at the Center for School Mental Health website as well as at sharedwork.org as soon as it becomes available. And we are also going to be reaching out to the presenters to see if we can make the slides immediately available, even prior to the recording being available. So check with us at our websites. Thanks to everybody, and have a wonderful afternoon.